right, let's go ahead and we have a graphic with some information about these procedures. Now, here we go, and pay attention because here's where a lot of the information comes in. The total joint replacement removes damaged or diseased parts of a joint and replaces them with new manufactured parts. That's right, you become bionic, maybe. It relieves pain, improves walking and other movements, and by far, hips and knees are replaced more often. So why are people more comfortable with these procedures today than they were a few years ago? Is it simply just education?
That's a huge part of it, Ed. But the other part is how we recover and how we prepare for surgery. We've come up with a few techniques now to help people accelerate the recovery process. We empower patients to recover well, and we want to make sure that they have a great outcome. The main techniques that we've used that have helped have been in pain control, making sure that we avoid these narcotic medicines, which have really received such negative press recently, and rightfully so. These are really very dangerous medications, and we try to mitigate the use of those after surgery. The other thing is with blood conservation, making sure that we're avoiding some of the medical issues that occur with joint replacement surgery, and most importantly is making people get back to their activities as quickly as they can, starting their therapy, walking the same day, and in many cases being able to be going home the same day and sleeping in your own bed after surgery.